Maccabi is Israel's leading and most advanced healthcare service organization, serving over 1.8 million beneficiaries nationwide. Our services are decentralized, as about 80% of the healthcare is provided by independent healthcare providers. One of the major challenges for any large organization is internal communication and knowledge management. Maccabi has created an ever-evolving system to manage its medical and administrative systems via a portal that is part of the desktop of every employee. The portal provides ongoing organizational updates, together with specific details about the services and forums that enable users to exchange information and knowledge. Maccabi's system maintains a sophisticated database that automatically updates the medical records and pharmacological history of every patient in real time. The immediate availability of medical records ensures that our patients receive rapid and effective treatment from any of our doctors. The Maccabi doctor is surrounded by a support system. His screen displays a comprehensive and up-to-date information on the patient, including medication, test results, chronic illnesses, allergies, reminders for health promotion, and more. X-rays are displayed on the doctor's computer along with the radiologist's interpretation. They can be enlarged, their contrast manipulated, and the findings explained to the patient on screen. Every drug prescribed is automatically checked against a central database for interaction with other medications that the patient is taking, as reflected by data on the purchase of the drug through the pharmacy system, thereby avoiding adverse reactions. The system also alerts the doctor to generic equivalents of the prescribed drugs and provides information on dosage and whether the medication is covered by the patient's insurance. A decision support system includes a rule engine that offers various lab tests, treatments, and recommendations that are tailored to the patient's individual needs. All referrals are sent electronically to the pharmacy, the laboratory, radiology clinics, consultants, and more. Maccabi has established professional consultation centers manned by highly trained specialists in key areas such as costly imaging services and highly specialized drug regimens. The request for consultation from the doctor's clinic is transmitted automatically to the consultation center. A response is generated in short order that approves the doctor's request or recommends an alternative and more appropriate diagnostic mode or treatment. Maccabi has developed sophisticated telemedicine services. For chronically ill patients, the system enables continuous monitoring. For example, a patient suffering from cardiac heart failure measures at home his blood pressure, weight, and pulse on a daily basis. The results are transmitted electronically to the attending nurse at the call center. A care plan is developed in accordance with the results. In cases where the results deviate from what is acceptable, the nurse receives an online alert and must decide on the appropriate steps to take, such as changing the care plan, referral to the cardiologist, or referral to the hospital while informing the patient's doctor of his condition. The patient's record is a shared record, accessible to the nurses in the CHF call center, the nurses in the cardiology clinic, the cardiologist, and the patient's personal doctor in his private clinic. The same concept enables us to monitor the vision of the diabetic patient who lives in an outlying area. A mobile digital unit is sent to clinics in remote locations to perform retinal screening fundoscopy in order to prevent blindness by early detection and treatment of diabetic retinopathy. The image is transmitted electronically to an expert ophthalmologist who has access to the patient's electronic medical record when he is interpreting the images. The attending doctor and the patient are able to see the images as well as the expert's diagnosis. Every Maccabi patient has access to his own medical record, and he can manage his own personal and dynamic health record, including storing medical documents and monitoring personal health measures such as physical activity, blood pressure, BMI, and more. He can access this information from anywhere in the world and can also choose to allow his doctor to have access to his personal information. An expectant mother can view her ultrasound examination on her home computer and see images of the fetus taken at the time of the exam. The patient can direct his electronic prescription to the pharmacy of his choice without waiting in line from his home computer via Maccabi's internet site. Maccabi's information and communication system supports evidence-based management. Patient registries for leading diseases and medical problems are updated automatically online. The registries are used to manage chronically ill patients and the overall efficiency of healthcare. Additionally, the registries have enabled us to develop disease-related budgets that compare the quality of care for a particular disease between regions, clinics, and even among individual doctors. Doctors can review aggregate data on their practice and even compare their practice profiles with that of their peers. These patient management tools are significant for the practicing doctor, and since implementing them, we have seen definitive improvement in the care of chronically ill patients. Maccabi's system reduces unnecessary paperwork for the doctor. The claims management system generates a claim from the patient record automatically as part of the doctor's natural workflow. Maccabi's system also benefits administration, who can access real-time data that provides them with comprehensive information such as how well they are doing in the Health Value-Added dashboard, which measures in real time the quality of clinical care provided, determined by predefined medical parameters and objectives, the quality of services as perceived by Maccabi patients measured by patient surveys and membership trends, the fiscal robustness of the organization as measured by its adherence to budgetary objectives. Maccabi's system enables the organization to perform surveillance and monitoring for early detection of threats and rapid response to real or potential crisis related to safeguarding the health and welfare of its patients. This system is totally operational and has proved itself time and again during emergency and national crisis situations. This online health information system enables Maccabi to realize its vision of promoting the comprehensive health of every patient, providing customized medical care for each patient, and fostering excellence in the quality of medicine, knowledge, and service. Maccabi Healthcare Services. Better systems, better health.